Welcome to Is Health and Safety on Your Agenda? Health and Safety for Board Members, brought to you by oh&s, Nova Scotia's Health and Community Services Safety Association. Workplace health and safety is increasingly recognized as a risk category that requires board-level attention in private, public, and not-for-profit organizations in Canada. While many organizations believe in high-quality workplace health and safety as a matter of principle, health and safety must be held to the same formal processes of identification, validation, quantification, and prioritization as other enterprise risks that are subject to board oversight. This module discusses how boards can ensure the quality of their due diligence and make an important contribution to the risk culture of their organization by assuming formal oversight of workplace health and safety risk. Every organization is at a different point in this journey toward excellence in health and safety management. Board members play an important role in supporting and championing the journey. This module is intended for Nova Scotia-based board members with a need for awareness-level information. There are 6 learning objectives for this module. After completing it, you will be able to describe the roles and responsibilities of board members and other workplace parties under the Occupational Health and Safety Act, identify oh&s as a business risk that needs to be managed along with all the others, describe the internal responsibility system, discuss due diligence and ways the board can demonstrate due diligence, apply knowledge of board members' health and safety obligations in a common scenario case study, and recognize that safety requires board-level leadership. First, we'll start by looking at health and safety as a business risk. Boards of directors across all sectors and industries are responsible for the oversight and governance of risks that could jeopardize the ongoing viability of the organization. Even though risks are often specific to particular industries or lines of business, workplace health and safety is increasingly recognized as a risk category that requires board-level attention in private, public, and not-for-profit organizations across Canada. This is of critical importance for board members of health and community services sector workplaces, since in Nova Scotia, these workplaces have the highest rate of injuries reported to the Workers' Compensation Board, otherwise known as WCB. Nova Scotia's healthcare and community service workers are more likely to be injured on the job than any other kind of worker in Nova Scotia. Not only does this result in pain and suffering for injured workers, but it also impacts resident/client care and the financial sustainability of care organizations in Nova Scotia. Workplace health and safety risks have the potential to impact a significant number of stakeholders, both internal and external, to the organization. As financial stewards of the organization, board members are accountable for the organization's ongoing financial viability, as well as being legally liable for how the organization is governed. Board members are accountable for the direct costs of health and safety, i.e., insurance rate increases, fines, etc. They are also accountable for the indirect costs of health and safety, which can include increased overtime costs, worker overload and burnout leading to injury and absence, lower quality of care and increased risk for clients, increased costs due to high turnover, such as training costs, recruitment costs, etc., and damage to an organization's reputation. Workplace health and safety also affects an organization's intangible assets, such as morale, employee engagement, and organizational culture. Ultimately, a decrease in any of these factors can lead to a decrease in an employee's ability to deliver safe and high-quality care and negatively impact the organization's financial sustainability. Do you know the impact that health and safety has on your organization? How many incidents took place last year for the past quarter? How many staff were off last year for the past quarter? What was your workers' compensation insurance rate last year? Is it higher or lower than this year? As a board member, it is important that you understand how health and safety is impacting your organization, your staff, and the people they care for. A successful risk management strategy requires that factors contributing to health and safety outcomes be subjected to a formal process of identification, validation, quantification, and prioritization. Managers, supervisors, and workers all need to play an active role in the identification, assessment, and mitigation of workplace hazards. The board should receive regular updates on their organization's oh&s issues so that they can ensure hazards are addressed in a formal risk management strategy. Does your organization have a risk management strategy? Although the strategy and goals will be specific to each organization, every board needs to be satisfied that their organization has an effective risk management strategy. The 4 attributes of an effective risk management strategy are: comprehensive. The strategy should demonstrate its ability to capture the majority of potential workplace incidents and scenarios. Systemic. The strategy should outline the process for managing risks and show whether or not this is happening effectively. Efficient. The strategy should establish its own costs and demonstrate value for money. Aligned. The strategy should be aligned with overall organizational objectives and other managed risks, such as reputational or operational risks. Risk interconnectivity. Organizations face risks in almost every aspect of their operation, and these risks are very much interconnected. This means that workplace health and safety has a direct influence on other operational and financial aspects of an organization. The diagram shows some of the many risks that are interconnected. A negative outcome in one area, like health and safety, can directly impact on one or more of the risks faced by an organization. Before moving on, let's talk about safety culture, what it is, and the role the board plays in creating it. A positive safety culture exists when a set of shared values and beliefs about workplace safety and health influences actions and drives practices for preventing workplace injuries and illnesses. Hopefully, you'll see that the board has a significant role to play in creating and supporting the safety culture of their organization. Boards can accomplish this by considering health and safety as a key strategic priority, on par with any other board issue. Reviewing and responding to oh&s reports submitted by management, and providing management with the support and resources to quickly and cooperatively address health and safety issues as they are identified. By working to ensure that there is a robust health and safety culture, a board can generate confidence, which strengthens workplace relations within the organization, reduce direct and indirect costs of injury, and gain recognition as a leader in workplace quality from funding agencies, stakeholders, and prospective employees. In this next section, we'll introduce you to Nova Scotia's Occupational Health and Safety Act. The Nova Scotia Occupational Health and Safety Act, otherwise known as the Act, sets a minimum standard for workplace health and safety in Nova Scotia. It provides for the promotion, coordination, administration, and enforcement of occupational health and safety in the province. Almost all workplaces in Nova Scotia are covered by and must comply with the Act and its regulations. In addition, some organizations may also be subject to specific government legislation, for example, police forces or hospitals. The Act provides for the development of regulations. These regulations spell out specific requirements of the Act or for minimizing the risk associated with specific hazards, for example, violence in the workplace regulations. Organizations should consult both the Act and the regulations to understand what they need to do to be fully compliant. As the board member of a healthcare or community service organization, you need to know that you share responsibility with all other workplace parties for ensuring your organization is compliant with the Act and its regulations. Also, keep in mind that the Act and its regulations are not written through the lens of health and community services. As such, it is important to be informed about what your organization needs to do to be compliant with the Act and all applicable regulations, including those not directly related to the Act, for example, fire regulations. Since Nova Scotia's Occupational Health and Safety Act is founded on the Internal Responsibility System, it is important that board members understand what that is. The Internal Responsibility System, or IRS, is a philosophy that states that the primary responsibility for health and safety resides within the organization and that everyone in the organization is responsible for health and safety according to their ability and level of authority. Each person must take the initiative to identify, report, and where able, control health and safety issues as well as help to make improvements on an ongoing basis. The IRS is effective when everyone recognizes and reports hazards, works jointly with others to reduce risk, incorporates health and safety into all aspects of work and decision making, and takes steps to protect their own safety and the safety of others. How does the IRS work? Everyone in the workplace shares a mutual responsibility to ensure the health and safety of everyone in their workplace and to take action to reduce risk at all times. The diagram illustrates that while the board is ultimately accountable for health and safety, the responsibility for health and safety is delegated to the senior management team and flows through all levels of the organization. An effective IRS does not happen on its own. Organizations need to build and maintain an effective IRS by making health and safety a priority. Think, do, and practice health and safety in all work activities. Conducting regular inspections. Collaborating and sharing information. Identifying, reporting, and working together to control hazards and reduce risk. Ensuring everyone knows their responsibilities is held accountable for their actions and decisions, and following all applicable procedures and legislation. You may be wondering what the benefits of having an effective IRS are. Well, they include collaborative approaches to identifying, assessing, and correcting workplace hazards, enhancement of safety culture, organization self-reliance, compliance through a joint management worker effort, promotion of best practices, and improved safety performance. Nova Scotia's Occupational Health and Safety Act is also based on what is commonly known as the 3 basic rights for health and safety. Nova Scotia's Occupational Health and Safety Act provides employees with a number of different rights related to workplace health and safety. The 3 most important, which are known as the 3 basic rights, are the right to know, the right to participate, and the right to refuse unsafe work. As a board member, you need to understand these rights and how they help ensure a safe and healthy work environment. We'll start by looking at the employee's right to know. While not explicitly stated in the Act is interpreted to mean that employees have the right to know about actual and potential dangers in the workplace and how to perform their job tasks safely. This right is derived from the duties of the employer to provide information, instruction, training, supervision, and facilities required for the health or safety of the employees, ensure employees, supervisors, and foremen are made familiar with health or safety hazards that may be at the workplace, and ensure employees are familiar with the proper use of all devices, equipment, and clothing required for their protection. Also, employees have the right to know about reports of occupational health or safety inspections and occupational health or safety monitoring or tests undertaken at the workplace, the current names of the members of the Joint Occupational Health and Safety Committee and the means to contact them, JOSH Committee meeting minutes, the Act and its regulations and how to contact the Nova Scotia Department of Labour and Advanced Education's oh&s division. Now let's move on to the employee's right to participate. Again, this right isn't explicitly stated in the Act, but is derived from the sections that speak to the employee's duties and the need for a joint occupational health and safety committee or health and safety representatives. Employees have a right to participate in their workplace's health and safety program by being a health and safety representative or member of a joint occupational health and safety committee or helping to select these, by reporting of hazards to a supervisor and working with the supervisor and coworkers to mitigate the risks associated with hazards, and by participating in health and safety related training, following safe work practices, and using safety devices. The final basic right is the employee's right to refuse unsafe work. This is the one basic right that is clearly stated in the Act. Section 43 says that any employee may refuse to do any act at the employee's place of employment where the employee has reasonable grounds for believing that the act is likely to endanger the employee's health or safety or the health or safety of any other person. Before refusing to work, the employee should report their concern to a supervisor and work cooperatively with the supervisor to address the concern. If the employee and supervisor cannot mitigate the concern, they should initiate the process for work refusals specified in the Act. As a board member, you need to ensure that processes are in place to ensure employees know about the hazards associated with their work and are provided with information and training to reduce their risk of injury or illness, ensure employees are able to actively participate in your organization's health and safety program, and support an employee's right to refuse unsafe work and that the board is informed about any work refusal and the steps taken to mitigate the concern and/or address the issues raised. The next section talks about the roles and responsibilities for health and safety that are specified in the Act. We've talked about a couple of them already, but there are many more that board members need to know about. Given that workplace health and safety management strategies and an effective IRS require action from all workplace parties, it is important to clarify roles and responsibilities. The Act stipulates specific roles and responsibilities, referred to as precautions and duties in the Act, for different workplace parties, including owners and boards, employers, and employees. We'll start by looking at the roles and responsibilities of boards or owners. Boards of directors are viewed as owners by the Occupational Health and Safety Act and its regulations. As such, boards must ensure the duties and precautions of the owner, as defined in the Act, are complied with. The Act requires owners and boards to put into place practices and provide resources that are reasonable in the circumstances to ensure the health and safety of people at or near their organization's workplace. Section 19 of the Nova Scotia Occupational Health and Safety Act says that every owner shall take every precaution that is reasonable in the circumstances to provide and maintain the owner's land or premises being used or to be used as a workplace in a manner that ensures the health and safety of persons at or near the workplace, in compliance with this Act and the regulations, and give to the employer at the workplace the information that is known to the owner or that the owner could reasonably be expected to know and necessary to identify and eliminate or control hazards to the health or safety of persons at the workplace. As noted earlier, boards can and typically do delegate responsibility for health and safety to organizational level executive management staff. However, boards cannot delegate away their accountability for health and safety. They are ultimately accountable and liable for the health and safety performance of their organization. As such, they should ensure board-level oversight of OH&S-related risk management strategies and exercise due diligence as it relates to OH&S compliance. Employers also have defined roles and responsibilities under the Act. In practice, the most senior management person at the workplace is considered the employer, and therefore has responsibility, under the direction of the board, for fulfilling the precautions and duties of the employer as defined in the Act. In addition, all management staff, including all those with supervisory responsibility, are considered to be representatives of the employer and need to ensure required employer duties are put into practice in a workplace on a day-to-day basis. A number of different sections of the OH&S Act outline precautions and duties for employers. Board members should understand these precautions and duties and have a process to ensure they are being fulfilled, since boards can be held accountable if they aren't. Section 13 of the Act lists primary precautions and duties. Two of these include: every employer shall take every precaution that is reasonable in the circumstances to ensure the health and safety of persons at or near the workplace. And every employer shall consult and cooperate with the Joint Occupational Health and Safety Committee or the Health and Safety Representative. Other employee duties include, in Section 27, the employer shall prepare and review, at least annually, a written OH&S policy in consultation with the committee or representative. In Section 28, the employer shall establish and maintain a written OH&S program in consultation with the committee or representative that is adapted to the circumstances of the organization for the purpose of implementing the employer's policy, this Act, and the regulations. And in Section 29, at every workplace where 20 or more persons are regularly employed, the employer shall establish and maintain one joint occupational health and safety committee. Employees also have roles and responsibilities defined under the Act. Everyone who is employed to do work for an organization is considered to be an employee under the Act. This includes all salaried and hourly paid staff and some contractors. The Act defines clear precautions and duties for employees, and all employees share the responsibility for helping to protect their own health and safety and the health and safety of others at or near the workplace. Section 17 of the Act outlines the main precautions and duties of employees. Some key ones include taking every reasonable precaution in the circumstances and cooperate with the employer and other employees to protect their own health and safety and that of others at or near the workplace, ensuring protective devices, equipment, or clothing required by the employer, the Act, or the regulations are used or worn, consulting and cooperating with the Joint Occupational Health and Safety Committee or the Health and Safety Representative, and complying with the Act and the regulations. Section 17 of the Act also states that, where an employee believes that any condition, device, equipment, machine, material, or thing, or any aspect of the workplace is or may be dangerous to the employee's health or safety, or that of any other person at the workplace, the employee shall immediately report it to a supervisor. Where the matter is not remedied to the employee's satisfaction, report it to the committee or the representative, and where the matter is still not remedied to the employee's satisfaction, report it to the Nova Scotia Department of Labor, OH&S Division. When talking about roles and responsibilities for health and safety, it is also important to understand what role the Joint Occupational Health and Safety Committee, or JOSH Committee, plays and their responsibilities. The Joint Occupational Health and Safety Committee is an internal resource that supports the IRS and helps to foster and maintain a health and safety culture and system. A JOSH committee is mandatory in workplaces with 20 or more employees and is comprised of workers and managers, but workers must always equal or outnumber managers. Responsibilities for the JOSH committee include providing feedback on health and safety policies, procedures, and training, conducting regular workplace inspections, assisting in injury investigation and work refusals, reviewing safety-related testing and reports, and recommending health and safety improvements to the employer. In smaller organizations that have less than 20 but more than 5 employees, a health and safety representative is required. The responsibilities of the rep are the same as the responsibilities of the JOSH committee, but on a much smaller scale. As a board member, do you know if your organization has a health and safety policy? Or does it need to have a health and safety program? Under the Act, employers are responsible for developing and updating at least annually a health and safety policy if the organization has 5 or more regular employees. For organizations that have 20 or more employees, employers must develop and maintain a health and safety program. Boards should ensure that the JOSH committee participates in the development of your health and safety policy and program. Board members need to ensure that elements of the program are administered correctly. Annually, the board should review and sign a safety policy that reflects management's commitment to the health and safety of its employees. As a board member, you no doubt know about the concept of due diligence when it comes to issues like your fiduciary responsibilities. We will look at due diligence as it relates to health and safety and board accountability and legal liability. Due diligence is a legal concept that all organizations need to understand and adhere to. As it relates to occupational health and safety, due diligence is being able to prove that every reasonable precaution in the circumstance was taken for the protection of the health and safety of employees and others at or near the workplace. The Canadian Centre for Occupational Health and Safety notes that due diligence is important as a legal defense for a person charged under occupational health and safety legislation. If charged, a defendant may be found not guilty if he or she can prove that due diligence was exercised. Issues of liability can apply if the organization fails to fulfill its legal obligation. If the board fails in its due diligence to ensure that the organization has a health and safety program, directors can be exposed to significant legal risk. Boards of directors must demonstrate due diligence by ensuring the organization has systems in place to properly oversee and manage all foreseeable health and safety risks. There are 3 factors that should be considered when establishing a due diligence defense: foreseeability, preventability, and control. Foreseeability must be considered in establishing a due diligence defense. For instance, a resident in a long-term care facility needs to be transferred from a bed to a wheelchair using a mechanical lift. The facility's safe handling and mobility policy requires 2 workers be present when using a mechanical lift. On this day, a staff member decides to use the lift without any help, and both the worker and the resident get hurt. Was this incident foreseeable? Yes, this incident was foreseeable. The facility has a specific policy to address the risks associated with this task. The policy is aligned with best practices that states 2 people are required when using a mechanical lift. Because the risk was foreseeable, did the board do everything reasonable to make workers aware of the risks? Did board members ensure the facility has policies related to safe handling and mobility, or SHM, that address the use of mechanical lifts? Did they ensure management makes staff aware of SHM policies? Did they provide ongoing SHM training to all staff? They audit SHM tasks and report on results? Did they investigate all SHM-related incidents? And did they take appropriate corrective actions? Due diligence also requires that all reasonable steps be taken to prevent incidents from occurring. For instance, a home care worker arrives at a client's home where the front steps have not been cleared of ice and snow. The agency's policy states that workers should not enter a home where snow has not been cleared from steps or walkways. Each year, the agency sends a letter reminding clients and workers of this policy and provides workers with slip, trip, and falls prevention training. Even so, the worker enters the home, slips and falls, sustaining a fractured skull and concussion. Was this incident preventable? Yes, this incident could have been prevented. Knowing the risks and being aware of the agency's policy, the worker should have contacted their supervisor and waited to have the steps cleared before entering the home. Knowing that this incident was preventable, did the board take all reasonable steps to help prevent this incident from occurring? As slips and falls are a significant cause of injury for home care workers, did the board verify letters were sent to clients and workers? Ensure workers are provided with slip, trip, and falls prevention training? Ensure senior management holds supervisors accountable to support staff when they report hazards and take positive steps to address the hazard and mitigate the risk? Did they ensure slip, trip, and fall incidents are investigated? And did they ensure management takes or implements appropriate corrective actions? Control is the level of authority a person assumes or has to prevent an incident from occurring. For instance, a community support worker is caring for a number of clients at a community-based home. The worker is unable to follow their normal schedule for providing care because one of their clients is sick. Because of this, a client becomes agitated and strikes the worker. After an investigation, it is determined the client's agitation was due to the care being provided to this client at a different time than normal. Could this situation have been controlled? The situation could have been controlled if a safe work procedure was in place to have the staff member call the supervisor to request that additional staff be assigned to the home when situations arise that disrupt normal schedule for providing care. It is likely the staff and supervisors knew that the schedule disruption would cause stress for some clients, and that when stressed, these clients become agitated and strike out. The board would need to ensure that the supervisor has authority to approve this request in a timely manner. Did the board take all reasonable steps to ensure authority was given to the appropriate person to help prevent this incident from occurring? Since the board should know their support workers may have to provide care to clients who demonstrate aggressive behaviors, did the board ensure that a policy was in place to address workplace violence risks? Staff, including supervisors, are aware of the policy and trained in approaches to help prevent incidents related to aggressive behaviors? Staff are aware of each client's behavioral history and triggers that may lead to aggressive behaviors? A procedure is in place to mitigate the risk of aggressive behaviors when staff members identify that certain triggers are or are likely to be present. Supervisors are authorized to take the necessary steps to mitigate the risk of violence when they are notified of concerns by a worker. Some approaches to exercising due diligence were discussed when we talked about foreseeability, preventability, and control. Let's look at some other approaches. It is imperative that boards exercise due diligence. Board members can exercise due diligence by working with their senior management to ensure that all the elements of their oh&s program is being administered properly. Let's take a look at some important elements of your oh&s program. Your oh&s program should place emphasis on the identification, assessment, and control of workplace hazards. The board should ensure that policies and procedures are in place to require proactive identification, assessment, and control of hazards. You should also receive regular reports on hazard identification, assessment, and control activities and monitor the effectiveness of your policies and procedures. The oh&s program for your organization should ensure that managers consult with employees prior to changes being made to facilities, equipment, schedules, work tasks, etc. The board should be aware when these sorts of changes are being planned and ensure management includes a plan to consult with employees about how the changes may impact the risk of injury for everyone at the workplace. Board members should ensure that all known hazards are communicated to employees. They should also make sure that employees are made aware of any controls that are implemented to mitigate the risk of exposure to these hazards and how to use or follow these controls. For example, safety equipment or devices, work-safe procedures, etc. Board members should ensure that the oh&s program requires a safety training plan be created for all employees. This plan should ensure that all employees are trained in the safe work practices relevant to their work. All those in and coming in contact with the workplace should be aware of the organization's safety policies and emergency procedures. You should ask for and review a safety training report so you can ensure all staff receive the training required on their safety training plan. Board members should ensure that all managers and supervisors are competent. This means ensuring that managers and supervisors are qualified because of their knowledge, training, and experience to do their work in a manner that ensures the health and safety of every person in the workplace. And they're knowledgeable about the Act and regulations that apply and potential or actual dangers to health and safety associated with the work. Board members can also exercise due diligence through a variety of activities. For example, having health and safety as a regular item on your agenda, receiving and reviewing regular reports on incidents, investigations, and corrective actions, inspections, hazards identified, risk assessment results, and controls implemented, and the status of recommendations from JOSH Committee or any orders from the Department of Labor or others, such as the Fire Marshal. Before we get to the case studies, the next section provides some basic information about health and safety legislation and enforcement. The Nova Scotia Occupational Health and Safety Act is designed to improve workplace health and safety in the province. It provides for the promotion, coordination, administration, and enforcement of occupational health and safety in Nova Scotia. Officers from the Occupational Health and Safety Division of the Department of Labor and Advanced Education have the power to access and inspect any provincially regulated worksite and issue orders for contraventions of the Act or its regulations. Officers can issue administrative penalties up to 14 days after an order is issued. Contraventions of the Act and its regulations can also lead to regulatory prosecutions. Nova Scotia has a special prosecutor to bring charges against companies or persons for contravening the Act and its regulations. In addition, the Criminal Code of Canada, Section 217.1, states that everyone who undertakes or has the authority to direct how others do work or performs a task is under a legal duty to take reasonable steps to prevent bodily harm to that person or any other person arising from that work or task. In Nova Scotia, administrative penalties are monetary penalties and can be issued by officers whenever an order is issued. Penalties can be issued to an organization and to the people who work for them, including employees, employers, such as managers, supervisors, owners, directors, and contractors or subcontractors. Penalties include fines that range from $100 for employees for a first offense up to $2,000 for employers for a third or subsequent offense. Depending on the nature of the contravention, oh&s officers may decide to provide education to an employer, collaborating with them to help resolve the health and safety issue. Officers may also issue orders with a timeline for compliance, but not issue a penalty. Penalties would likely be issued for high-risk contraventions or those that were previously identified and not addressed. Penalties will also likely be issued for repeatedly failing to comply with an order and/or for high-risk contraventions. Board members can be held legally responsible if their organization fails to ensure compliance with the Act and its regulations, or if the directors are found to not have taken reasonable steps to prevent bodily harm to their employees. Although this is a rare occurrence, there are cases in other Canadian jurisdictions where this has occurred. The director of a Mississauga-based company was fined $3,000 after pleading guilty to failing to ensure that workers using elevating work platforms use safety belts to protect them against falls. A court sentenced a frontline supervisor to 3.5 years in prison for 4 counts of criminal negligence causing death and 1 of criminal negligence causing bodily harm after a swing stage failed and 5 workers, all of whom were not attached to lifelines, fell over 100 feet to the ground. 4 died and 1 survived, but with serious injuries. Take some time to look at the following case study. Think about what would you as a board member do. Some recommendations will follow each case study. On the following screens, you will be presented with a workplace health and safety scenario. First, the facts of the case will be presented. Then, using your experience as a board member, along with knowledge gained in this course, consider the questions presented. A worker in your organization has experienced threats and intimidating behavior by a client. The worker reported the situation to their immediate supervisor, but the supervisor failed to deal with the situation. The worker decided to report the issue to their JOSH committee. The committee reviewed the complaint and issued written recommendations to the management. The issue was never addressed or remedied. Eventually, the worker was assaulted by the client and suffered a serious injury. Department of Labor and Advanced Education were called and requested information from board members. The labor officer ordered a violence hazard risk assessment, establishment of a workplace violence prevention policy and program, which included training related to violence awareness and approaches to address challenging behaviors. Question 1. What should the board have done to avoid this situation? The board should ensure that health and safety has been incorporated into its overall risk management strategy. This means the board must ask fundamental questions about the risks to health and safety for their employees. Board members should know what the main risk factors are and ensure they are addressed through a comprehensive risk management strategy and workplace oh&s program. Knowing that workplace violence is a significant risk in health and community service sector workplaces, the board should ensure that a prevention of violence in the workplace program is established, maintained, and effectively implemented. For your information, a workplace violence prevention program is required in Nova Scotia. The board should receive regular reports of issues raised at the Joint Occupational Health and Safety Committee and all recommendations submitted to the employer by the committee. The board should review the status of the response to JOSH committee recommendations and strategies to mitigate risk. The board should be informed when an employer decides not to implement the recommendations of the JOSH committee and why this decision was made. The board should hold organizational management accountable for responding to JOSH committee recommendations in a meaningful and timely manner and for taking all reasonable steps to mitigate risks to worker health and safety. Question 2. How can the board ensure that the organization is effectively implementing the oh&s program? Require regular briefings to the board on health and safety activities, including the hazard management program. Review the oh&s program at least once a year to ensure the system is functioning as intended. The board and senior management should receive a report that highlights gaps found during the review. The board should ensure that gaps are closed to ensure a properly functioning program. Ask for regular reports on incidents and their corrective actions. How can the board work with the CEO or senior management to ensure they are fulfilling their roles and responsibilities under the Act? Ensure management is working with the JOSH committee and taking steps to maintain and strengthen the IRS by Ensuring health and safety is a regular meeting agenda item for all management meetings. Holding workers and supervisors accountable for proper hazard management process. Regularly reporting issues identified by the JOSH Committee to the Board. Reporting injury and illness trends to the Board. And by keeping the Board informed of new health and safety issues, legislation, etc. Before we finish, take some time to consider how confident are you? On a scale of 1 to 10, with 1 being very low and 10 being very high, how confident are you that your organization ensures all workers comply with the Nova Scotia Occupational Health and Safety Act, regulations, and its own internal policies and procedures? If you said anything less than an 8, you should take steps to increase your level of confidence. Ask that health and safety be added to your agenda of your next and all future board meetings. Ensure that you receive and review reports about the performance and activities of your health and safety management system and/or program. Ensure the board is aware of risks in the organization and hold senior management accountable for committing resources to implementing effective risk mitigation strategies. Another confidence question. On a scale of 1 to 10, with 1 being very low and 10 being very high, how confident are you that your organization has an effective process for reporting missing or defective equipment or protective devices to the employer or supervisor? If you said anything less than an 8, you should take steps to increase your level of confidence. Ensure that you receive and review reports related to workplace inspections, the hazards identified and assessed, and the approaches taken to mitigate risk. If these steps are not being followed, ask senior management why and hold them accountable. Conduct semi-annual board safety tours or inspections. Take time to talk to employees about health and safety. Ask if they find the hazard identification, assessment, and control processes to be effective. Ask if they feel supervisors are supportive and work collaboratively to assess and mitigate risk when hazards are brought to their attention. Good health and safety requires board-level leadership. As you can now see, board oversight is critical when it comes to the issue of health and safety in the workplace. Boards play a necessary role in working with its senior management team in providing a positive culture of workplace safety. Take a moment now to think about and record any actions your board needs to take to improve the quality of its health and safety due diligence. What are the 1 or 2 things you and the board can do immediately to improve your organization's health and safety performance? In conclusion, ask yourself if you are a safer leader. Speak. Talk the talk. Do you talk about health and safety at all board meetings? With senior management? During performance reviews? Or when you see employees? Do you let your staff know that their health and safety is a key priority for your organization? Act. Walk the walk. Do you follow your organization's health and safety policies and procedures at all times? Focus. Unrelenting concern for safety. Do you ensure that the board and the senior management team are focused on health and safety outcomes for staff, for those your staff care for, and for the organization? Engage. Get others involved. Do you engage and encourage people to get involved and take actions to reduce risk and improve health and safety outcomes? And finally, do you recognize those people in your organization who are doing the right thing? Does the board celebrate and recognize the work of the JOSH Committee? Do you participate in health and safety activities and thank your staff for their continued efforts to identify hazards and reduce risk? Thank you for completing oh&s's Is Health and Safety on Your Agenda? Health and Safety for Board Members, e-learning module. No matter where you are on your health and safety journey, oh&s has the people, knowledge, and solutions to help your board lead the way to enhanced health and safety performance for your organization. If your board would like more information on any of these issues raised in this e-learning module, please visit our website, www.awareness.ca, or call us toll-free at 1-877-538-7228.